Good afternoon, preppers. Welcome to Goshen Prepping. You need to understand, very important, we're actually entering a dangerous era when it comes to modern medicine. And we've been seeing shortages and closures all across the board. In fact, all across the country. And it's progressively getting worse, much worse. So you might not get the medical coverage where you live, especially when it comes to emergency coverage, which of course is essential and vital. So let's take a look at a few articles. Let's jump right into it. And I want to show you the dire situation we're in. And I'm not going to spend a lot of time with each article because there's a lot of them, but I will link them below so you can read them yourself. Nursing shortage looms large and projected to intensify in the next 18 months. A survey among healthcare leaders, 92% of them indicate there will be a nursing shortage that will intensify in the coming 18 months. For decades, industry experts have been sounding the alarm on the nursing shortage, but now it's a full-blown crisis. I think we know that, though. We've been seeing that in the news. How about this, though? EMTs sounding their own alarms on industry-wide shortage impact patient care. And it goes through talking about the pay for EMTs and also how Medicaid, Medicare are not paying them, reimbursing them for a lot of the calls. And they're seeing an extreme shortage starting to back up intake at local hospitals. People don't understand how important private EMT is to the whole healthcare system. That is true. And of course, we've mentioned this before, we have a huge drug shortage. Some of the big ones we're seeing, like Tamiflu is an antiviral, amoxicillin, antibiotics, etc. Many infections and conditions have multiple solutions, so a shortage in one medication may just increase their reliance on another. Not to mention price increases and shortages as well. Any medication is at possible risk of being short supply in the next 12 months. We're also seeing in this situation small town nursing homes starting to close as well. They're not getting the staff. The problem could deepen as pandemic-era government assistance dries up and care facilities struggle to compete with rising wages. In a year and a half, the number of workers in nursing homes and other facilities dropped by 410,000. The Center for Medicare and Medicaid Services reported 129 nursing homes have closed in 2022, and it's supposed to only get worse. Demand for long-term care is expected to climb over the next decade as the baby boomers grow older. And speaking of care facilities, unsustainable losses are forcing hospitals to make heart-wrenching cuts and closures. Billions in losses and negative operating margins are expected to be commonplace through the year end. And this article is a few weeks old, but it says 53 to 68% of the nation's hospitals will end 2022 in red versus 34% only a couple years earlier. It is getting much more difficult for them to operate. Community hospitals are facing an impossible dilemma. Should they be taken over by a bigger system or close entirely? And that's what it comes down to. Corporations are gobbling up these small hospitals, making it more affordable for them to operate, but of course, making it so it's staying out of the hands of the people per se. And the last article I want to show you from Becker's Hospital CFO report, 631 hospitals at risk of closure and listed on this database state by state. You can go through and see all the different states, how many hospitals are at risk at closing and what percentage of the hospitals are in the state. But at the top, you can actually click on the database and see for yourself which ones may be at risk where you're living. And again, I'll link that in the description below. But you have to understand major corporations and governments are taking over these hospitals, these rural hospitals and privately owned hospitals and making them into the big corporation hospitals that we're seeing. It's cutting the cost for them, but it takes it out of the hand of the people, which I do not like. Either way, we need to be prepared. And one of the ways I always say to be prepared, and I've showed this book before, is the Survival Medicine Handbook by Dr. Alton and his wife, Amy. It is fantastic, and it's a book that you can actually use when there are no doctors, when there are no hospitals, when there are no EMTs coming for you, which of course is a scenario we're actually preparing for because it very well may happen. So I'll link this book in the description below. All right, on top of that, this next video will actually help you with as far as things you should be stockpiling and keeping in your stock. I have a whole bunch of medical videos about this so that we always have everything on hand in case there is an emergency. So go ahead and check this next video, and thank you for watching.